Welcome to True Health Tuesday, and the truth will set you free. Today is exciting. It's carpal tunnel syndrome, and this is going to be fun. Now, when you look at this, carpal tunnel is literally pressure on the median nerve, and that runs right down the middle of the wrist. It's called syndrome because it's also known as a double crush injury. That means it begins in the neck, affecting the nerves that supply the wrist. Now, anything that damages the neck, or if the head's forward, you're choking off the nerve supply and possibly the blood supply to that upper extremity. Now, that means it begins here and affects the carpal bones or the wrist. Now, when you look at this, it's the most amazing design. Now, when you look at all of the carpals, think of a Roman arch, okay, where it's Roman arch has been around a couple thousand years. Underneath that is the median nerve. Now, the extensors run on the top of the arch. Those are the muscles that open up the hand. So if you have good tone of the extensors, it maintains that arch. If the extensors are weak, that means the muscles on the back of the forearm are weak, then that arch falls and puts pressure on that median nerve. Now, the insane stuff is there's a ligament, okay, that goes around the front and the back of the wrist. This is called a flexor retinaculum and extensor retinaculum. Well, what they're going to do for the surgery, they actually cut that ligament to de-stress out that median nerve. It's one of the craziest operations ever. Now, what I would do when I was teaching human dissection, I would open up and just having the wrist like this, you can stick a dime, and this is how big that opening is, in that tunnel area. So just know that carpal tunnel is a tunnel. Now, when you look, it's very common to see, like 100% of the time that I've seen, is a muscle imbalance of the forearm. Now, normal strength ratio, flexors versus extensors, is 5-4. That means the extensors are almost as strong as the flexors. Now, where the flexors are overdeveloped, and this is just modern society. Every time you're grabbing something, that means the extensors are getting used, so that creates a significant muscle imbalance. Now, occupations, office workers, truck drivers, hairstylists, mechanics, anybody using those flexors more than the extensors are going to have a muscle imbalance of the forearm. And when you look at all the flexors, there's going to be the brachioradialis, all the flexor digitorum, profundus, superficialis. There's so many flexors that go through that tunnel in order to open and close the hand. The extensors come out of the back of the hand. Now, the long-term imbalance combined with forward head carriage is the perfect combination for developing carpal tunnel syndrome. Now, in every carpal tunnel syndrome case, it's vital to correct the cervical subluxations. And then you got to do that first. Then assess and correct any elbow subluxations, because the medial ulnar subluxations are also involved or could be involved with the carpal tunnel syndrome. Lastly, you can work on the carpal bones and strengthening the extensors of the forearm to restore the muscle balance. So just like you're working from proximal, or right where the neck is, down to the distal where the wrist is. And this is huge. And you can see these nerves. So if the cervical spine is impinged, obviously it's going to negatively affect the elbow. Obviously it's going to negatively affect the wrist. So carpal tunnel syndrome should clue you that it is not involving just the wrist. The wrist is more the alarm. This is the brachial plexus. And I can still draw this from memory, okay? And if anyone's curious about the mnemonics, it's a 5-3-6-3 many. Robert Taylor drinks cold beer. Roots, trunks, divisions, cords, branches. So when you look at this, you can literally, I actually made all the students draw it from memory. We actually had to do this, I think, on one of the board tests. We have 4 board that you have to pass. But you can see that if you compromise And where it says C, that's cervical. So C5, C6, C7, C8, and T1 are literally all of the nerves that supply that upper extremity, that brachial plexus. And you can see if you compromise C5, that's a part of the median nerve. C6, part of the median nerve. C7, part of the median nerve. C8, T1. So any area that's impinged of the brachial plexus can lead to that median nerve symptoms and could be a contributing factor. Now, this is a big warning about carpal tunnel syndrome. There's several false methods to assess, correct, and treat the carpal bones, usually involving flexion or extension of the wrist, as well as mobilization of the carpal bones. These methods are contraindicated in cases of carpal tunnel syndrome. Any mobilization will cause a worsening of the muscle imbalance and will aggravate the patient's symptoms. And huge. So they call it prayer sign when you're stretching the extensors. Those things I've seen has exercises, but there are also alarms to tell you that there is instability of those carpal bones, and there is a muscle imbalance, and there is nerve impingement. In addition to correcting the neck and elbow subluxations, the best method to treat the wrist is to open up or distract those carpal bones. Contact the distal aspect of both your ulnar and radius with your thumb and index fingers. Your palms and the fingers will grasp the carpals and open it up. Make sure you don't hyperflex or extend the wrist, only neutral. So you want that wrist in a neutral position. This will provide immediate pain relief for the patient and is the only effective way to directly treat carpal tunnel syndrome. And this is what it looks like. So you grab that wrist. You're not going to bend it or extend it. It's in a neutral position. And then you just slide your thumbs open so you're distracting that wrist. Contact the distal radius, distal ulnar with your thumbs, anterior aspect of the carpals with your fingers underneath, and apply pressure with your thumbs to open it up in the opposite direction. So it's literally opening that area up, and that's going to distract those bones. I've seen people whip the wrist. You don't want to do that. I've seen people bend or pull. You don't want to do that. The lunate, which is one of the carpal bones, and that's one of the most commonly subluxated bones, that is also one of the peaks of that carpal arch. And that lunate can drop down and put pressure on the median nerve. So you don't want to push that bone in. You want to distract the joint and de-stress out that wrist. And this is going to be amazing, but it's also going to realign some of those carpals, and just fantastic. When you start adjusting, and I do not recommend you in carpal tunnel that you adjust the carpal bones immediately. Remember, you have got to correct that cervical spine, the elbow, and then distract, and then you can strengthen. Now, the exercise for carpal tunnel, this is the greatest one ever. You've corrected or addressing the cervical spine, you've corrected the elbow, you've distracted the wrist. Now we can work on the strength ratio of the forearm to correct that. Now, since the flexors are overactive, the best exercise is to isolate the extensors and work on those. Now, there are many extension exercises. The simplest, easiest one is to use a number 32 rubber band. It's been the most effective and the easiest way to restore the strength ratio balance of the forearm. If the patient is really muscular, they can use 2 number 32 rubber bands for this exercise. I wouldn't recommend more than 2, 3 unless they're massive. And when I say number 32, there literally are a gauging of the rubber band. And it's interesting because when I work in Bangkok, I have to bring our rubber bands over there because they make rubber bands out of real rubber. I mean, these guys are way, way thicker, way stronger, and way harder. But the number 32 rubber band, you can also use a hair tie. And those little bungee rubber hair ties seem to work pretty well too. Now, I call it flower bud to claw. Perform this rubber band exercise until fatigue. Just like any other muscle of the body, it'll take time and repetition to build these extensors. Perform this exercise for several minutes and repeat this exercise several times throughout the day. For really large forearms, utilize 2 rubber bands instead of 1. This exercise is especially great for people that are that chronically have their fingers and hands in a flex position, such as office workers, guitarists, particularly people who work with machinery. It's hugely common. This is what it looks like. Flower bud to claw, flower bud to claw. And my instructions 100% of the time are do it to fatigue, but make sure when you're doing this that head is lifted up, your chin is up in the air. I don't want you doing the exercise like this because, again, you're compromising the blood supply and nerve supply. You do it like this, you have the blood supply and nerve supply restored. Do it to fatigue, then relax, then do it some more because you're correcting a muscle imbalance. And that's why I tell people do it when you're driving or do it at the office, do it at lunch. But also a lot of sports. Think of every time you grab a tennis racket or a golf club or any sport that involves that, if you create that normal balance of the forearm, you're getting an exponentially increase in performance. Now, taping for stabilization. In extreme cases of carpal tunnel, where there is massive instability, tape can be used for their support for the wrist. I prefer electric tape because it's flexible, stable. 1 layer of tape is plenty enough to provide stability. To apply the tape properly, have the patient touch their 5th and 1st digit. While the patient holds their fingers in this position, apply the tape to the proximal aspect of the metacarpals. Once this tape is in place, the patient can perform all their normal motions. And it literally is, to put the thumb and pinky together, you wrap the tape around it, okay, just 1 layer, and then when you let go of it, it maintains that integrity. So it's literally, well, if you had fingernails, you can get the tape off. But once you get this tape off, put the pinky and thumb together, you'll see, and it goes right around the base of the metacarpals 1 time and open it up. And then you can see it maintains that tunnel, and you could do every activity. Honestly, patients only need this for maybe a week while they're adjusting the cervical spine, restoring the muscle balance. You've corrected the elbow and everything else. This is also fantastic if the person is sleeping and their numbness in the hand or that carpal tunnel syndrome wakes up at night. It's absolutely fantastic. And the neat thing, if you've got hairy forearms, it doesn't stick, and I tell patients, it doesn't stick to fur. So electric tape is preferred. Now, this maintains the integrity of the carpal tunnel, takes pressure off the median nerve. Excellent solution for the patients that wake up in the middle of the night in response to that carpal tunnel syndrome. The patient can tape themselves like this before bed. Usually they'll get a full night's sleep for the first time in months. This can also be used during the day to stabilize the wrist or any activity. I mean, it's just fantastic that the body can heal in so many ways. But look at carpal tunnel syndrome has an alarm to a cervical problem, muscle imbalance, and the wrist is really not the problem. It's just the alarm telling you that there is some dysfunction. So when we talk about the 5 keys to health, number 1, nerve supply. You got to get that cervical spine corrected. The regular exercise, and specifically for this, to do that, to restore the muscle balance. And one of the things that drives me crazy is when they put the whole wrist in a brace. Okay, do you want to know how to make a muscle imbalance worse? Brace it. Okay, that is just like mind-blowingly crazy. Then proper nutrition. Why? Because you're rebuilding tissue. That means if man makes it, you don't eat it. Your diet is going to be the same as the 10,000 generations that preceded you. Remember, all those people ate organic, they ate healthy, they ate seasonal, they ate varied, they ate fermented. I mean, that's how our species works. Sufficient rest. That means that you sleep good all the way through the night, waking up in the morning refreshed. If you're not good at sleeping, check out our videos. And then prayer and meditation. Every study involving prayer shows better healing. And when you realize that you're made in the image and likeness of God and that the world was built for you and you were built for the world, that's pretty cool. I got a really good relationship with God. Talk to him every day. Okay, so God bless you all. Stay healthy, my friends. Oh, also too, put all your questions after this. We got to divide the questions up into two things. One where I can speak freely is on the Dr. BBIP site, where we're going to divide the questions up into what I can answer on social media and what I need to say. God bless you all, my friends.